my name is Machelle Pecoraro, and I'm from Murfreesboro, Tennessee. I've lived here my entire life. I've thought about moving several times. I've got to visit some amazing places that I've considered, but this has always ended up being home. I got into archery because of my oldest son. He was in the 4th grade in elementary school and came home one day and told me that they were going to be shooting bows and arrows. And I thought, that cannot be right. That's a weapon. It has to be, a soft tip, something that's not harmful.
She was like, dear God, they have real arrows. Like, these aren't fake. They have tips on them and they're shooting them.
It was real bows and real arrows.
She eventually became one of my coaches and helped me out till my senior year.
The most exciting thing about archery, particularly for my family, is it is something that we could all compete in. It's equal to everybody. Anybody can do it with a little bit of confidence, a little bit of patience. Before I was diagnosed with HAE, I knew that I had a disease that was a killer because my father had died from it, and I knew that I'd inherited it. He was only in his 20s when he died, and he actually passed away in a doctor's office. Hereditary angioedema, or HAE, is a genetic disorder that is extremely rare, but we have attacks of swelling all over the body, and my attacks started at around age 3 or 4. I wasn't officially diagnosed until 21. My life was 100% consumed by HAE. Even with my father's history, we didn't realize that it was a genetic thing. And so I would go to school with my face swollen. My parents would get accused of abuse. It was a difficult life. I drove to Birmingham, Alabama, from Middle Tennessee for 2.5, 3 years to participate in that trial. But by then I'd had my children, and I knew the possibility was there for them to inherit this disease. In the beginning of the trial, I was going 2 to 3 times a month. It took a lot of time out of our life, but looking back at that now, it doesn't seem like it. I mean, I had been sick for so long. What was 1 or 2 trips to Alabama? But I knew I had to do it for those little boys.
The changes that I noticed with my mom is that, she could coach an archery team, and she wasn't sick all the time.
And we're able to go on more trips or more longer car rides without her feet swelling that badly.
All of a sudden, my oldest son said, "How long has it been since you swelled?" And I thought, I don't know. And I had to go and look at a calendar. And it was almost too much to believe that it had been weeks since I swelled. And suddenly those weeks turned into months. And used to, not only did it consume my life, it consumed theirs. Functions at school, slumber parties, birthday parties, Christmases, and to hear the two of them say, "I don't remember the last time you had an attack." That made every mile worth it. Every mile. I was really surprised at how easy it was for them to teach me how to do the subcutaneous injections. It really was just very simple for me to learn how to do that. And the most important thing to me about that was it was on my time, what worked for me. If the morning was better, the afternoon was better, it was my time. Again, it was one of those things where HAE did not dictate my life. The biggest difference that I think since I started taking HAEGARDA is that for the first time in my life, I have a glimpse of what normal is. I can horse around with my kids and not worry about accidentally bumping an elbow or sitting too long on a bleacher watching them participate in something, or be late to school because I was so sick that I couldn't drive them. I can plan my life and HAE not be in control of me. It's important to me to prevent my HAE attacks because I'm a busy mom, a very busy wife. I have a job, I travel, I'm a patient advocate. Patients are able to come and not only hear my story and what led me to the choices that I've made, but they also get to connect with other patients that may live in their area. Some of them, for the first time, actually be in a room with somebody else that feels the way they do. That's a life-changing experience to be able to do that. My hope for HAE patients is that they do not give up, that they keep fighting, that they keep searching for answers.
Now here's some important safety information that you need to know about HAEGARDA.
HAEGARDA, C1 Esterase Inhibitor Subcutaneous Human, is an injectable medicine used to prevent swelling and/or painful attacks in patients 6 years of age and older with hereditary angioedema, HAE. A healthcare professional can teach you or caregiver to self-administer HAEGARDA for prophylaxis. Do not use HAEGARDA to treat an acute HAE attack once it starts. Work with your physician to plan for attacks if they occur. Do not use HAEGARDA if you have previously experienced life-threatening immediate hypersensitivity reactions, such as shock to HAEGARDA or other C1-INH products. Immediately report any symptoms of allergic reactions to HAEGARDA, including hives, chest tightness, wheezing, difficulty breathing, turning blue, faintness, facial swelling, and fast heartbeat. Before starting HAEGARDA, tell your healthcare provider about all medical conditions you have, including pregnancy or nursing, a history of heart disease or stroke, an indwelling catheter or access device in a vein, or immobilization for a sustained period. Also tell your physician about any other medications you're taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. High doses of C1-INH have been known to increase the risk of blood clots. Immediately report to your physician or an emergency room if you have any of the following symptoms of a blood clot: pain or swelling of arm or leg, with warmth or discoloration over the affected area, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, rapid pulse, and numbness or weakness on one side of the body. In clinical studies, the most common side effects reported with HAEGARDA were injection site reactions, pain, redness, swelling, hypersensitivity, itching and rash, dizziness, and nasal symptoms, including stuffy or runny nose and sneezing. These are not the only side effects possible with HAEGARDA. Tell your healthcare provider about any side effect that bothers you or does not go away. Because HAEGARDA is made from human blood, the risk that it may transmit infectious agents, including viruses and, theoretically, the agents of Creutzfeldt-Jakob disease, CJD, and its variant form, VCJD, cannot be completely eliminated. Please see full prescribing information for HAEGARDA, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.